Kick it off this hour with this. Former Secretary of State Hillary Clinton back after losing the election to President Trump. She took to the stage in San Francisco last night to slam the GOP health care bill while speaking at a conference about the inclusion of women in the workplace. Watch.
We will need to fight back twice as hard, not for the sake of politics, but because these are bad policies that will hurt people and take our country in the wrong direction. When this disastrous bill failed, it was a victory for all Americans.
Joining me right now is Chief Strategist for President Clinton's 1996 re-election and Hillary Clinton's 2008 presidential campaign, Mark Penn. Mark, good to see you, my friend.
Good morning.
The former presidential candidate back in the spotlight, huh? Critical of this new administration. What did you make of her comments last night?
I thought they were fair comments. I thought they were on target. I think this bill was sold absolutely terribly. If there were benefits to it, I don't think anybody knew it. I think everybody got the CBO report. The 24 million people would lose their health care. And so I think she was fair to make those comments and fair to stress that this plan so far has never been sold or demonstrated to have any real benefits.
Hard to argue.
It's hard to argue, and there was that Quinnipiac poll that came out last week that I think 17% of people in the poll, Mark, approved of the House GOP bill. But you look down the road when Americans once again this fall are going to get hit with premium increases and find out if their insurers are even going to be around in their state plans for the following year, assuming that the GOP doesn't do anything with Obamacare between now and then. Would that then give them some political mojo, if you will, to change it? Because, again, insurers leaving, premiums skyrocketing, that's the hallmark of Obamacare.
Well, yes, and in that same poll, 70% said they wanted to replace or repeal Obamacare. And so the problem is not that there isn't sentiment for a new health care reform. The problem is that bill either wasn't a good bill and was terribly sold and unveiled, and therefore is a non-starter. It's back to the drawing board. It's back to bipartisanship, I suspect, if they're going to get anywhere, because I don't think they're going to get a bill with the Freedom Caucus that is a bill that is going to pass public muster.
Mark, do you think the president can get, it's Kevin Kelly, do you think the president can get some Democrats to coalesce around a new bill and work with him? Because it seems like they're entrenched on being divisive and also not supporting him in any way, shape, and form. Do you think he can get them to come around and they could actually use this as a launching pad to re-energize the Democratic Party? Do you think they'll work with him?
I don't think it's going to be easy. Look, there's a lot of bad blood all over in Washington, between the two sides, between the activists. But do I think, you know, my experience in '96, Gingrich and President Clinton attacked each other all day long, and in the evening they met and made deals. Will we get back to that? I don't know. It's going to take a lot of work on President Trump's part if he's going to achieve that. The first thing is for him to realize that's what he needs to achieve if he wants to have a successful presidency. Otherwise, it doesn't look like he's going to be able to get anything done.